And now we move to the global south, as some call a developing country, rapidly developing country, Colombia, and a large city, Bogota, of more than 8 million inhabitants. And and what calls the attention is I am using this cartoon, which is really interesting because for many it looks like all the things that we have been working in sustainable mobility for years are happening in Barcelona, in London, and also here in Bogota. But for some, could be just an opportunistic thing that we cyclist advocates and sustainable mobility advocates are taking for granted. And what we're seeing due to the very important and difficult health crisis is fewer cars, cleaner air, safer streets, things that we have been working for years to achieve. Of course, they are happening for the wrong reason, and they are having really bad impact on the economy and the livelihoods of many people. But if we seize this opportunity as the Venn diagram that Tom just showed us, we can get really far ahead. Uh, and to mention something that is important in the terms of context, the Colombian cities are cities that move sustainably right now, mostly in public transport, in bicycle, walking. Car use is not high, motorcycle use is not high, but it is increasing. In most of the cities, the car and motorcycle use is rapidly growing before the crisis, and that's something that we needed to address. But I was it's very important that the very ambitious goal of London, Bogota has already achieved it. Bogota has 80% of the trips walking, bicycling, and public transport, and has been kind of stable over the last 2 decades. Not the same for other Colombian cities. We have seen especially a rapid growth of motorcycles. And the reason that motorcycles and cars are growing, in one hand, is the positive uh, reason of economic development, but on the other hand, is unfortunately our public transport systems have very low quality according to the user surveys. So bad quality in public transport and increasing income of the people is reducing the use of public transportation systems in most cities. What is growing really fast is the use of bikes, mostly because of community pressure and personal decisions by people, not necessarily by the support of government through infrastructure and other services. The consequences of the trend we were facing are really bad. Despite the fact that Bogota has 80% of the trips in walking, bicycling, and public transportation, we see a lot of exclusion. The travel times for the people, low income population are much higher than for the rest of the people. Travel cost and the share of the cost for them is also higher than for other income groups. Road fatalities, more than 500 a year. Air pollution, more than 2,000 premature deaths per year. And congestion. Bogota is rated as one of the most congested cities in the world by INRIX and by TomTom, but they only measure congestion for cars. They don't measure the whole trip for everybody. So to face these things in Bogota and in the rest of the country, and its important statement is that the national government issued the urban and regional mobility policy on April 14. Is in the middle of the pandemic, a national policy to promote public transportation, walking and bicycling in the Colombian cities. And this is very interesting and important because even though we were facing the crisis, the national government was looking forward, looking for sustainable mobility at the urban and regional level. And most of the policies that are in these national government documents are the ones that we have been fighting to implement for many years. And in terms of the city of Bogota, it has a really bold vision that it's very inclusive. It talks about equal opportunities for women, youth, with gender perspective, regional approach, and citizens culture. It's a very important vision of the local plan that has been just approved 2 weeks ago by the city council. The plan was prepared before the crisis, but they needed to adapt the plan during the approval, so to prioritize health needs, social attention, and economic recuperation. But they kept the same vision. They didn't change the overall vision. They just shifted some priorities around. And in mobility, they still keep the same main projects, programs, and activities. Uh, Not necessarily under these three statements, but the local policy in Bogota is trying to follow some of these things. First, the World Health Organization recommended traveling by foot and bicycle, and the examples that we just saw from Barcelona and from London are really remarkable examples on things to do regarding improving the experience of walking and bicycling. The occupancy of public transport needs to be low to reduce exposure. And in Colombia, the Ministry of Transport established 35% occupancy on average. It's not a fixed number, but on average, 35% occupancy of public transportation. And now we are seeing emerging evidence that probably this is something to review with data, because it is not the statements that the English government is making regarding not using public transport probably need to be reviewed, and also here in the developing countries. And there's this pressure to use cars and motorcycles as a healthy way to move around. So we have these two opportunities: try to do what Paris and London are doing, or just let the market continue working as it is happening in Wuhan at this moment, where car sales are booming. And Bogota is trying to do, at the scale of Bogota and the conditions of Bogota, more close to London and Paris than to the laissez-faire of the Chinese cities at this moment. There are four things that are important to see and focus during the upcoming time, not just during the crisis, but looking forward. How we move, the modal share, how satisfied are with the way we are moving, how safe we travel, and the expenditure of low-income people. Unfortunately, the local plan is not setting targets regarding how we move and how satisfied we are, but they are setting very ambitious targets regarding safe travel and expenditure. Bogota, as I mentioned, has around 80% of use of sustainable modes, and hopefully this will continue with the measures that are being taken. But the satisfaction with public transportation is really low. The BRT system in the city, we don't have a metro. The project to build the metro is right now contracted, and we will have a metro in the upcoming years, but we have a very extensive BRT system, but the user ratings of quality for the BRT system are really low, as well as the ratings for the rest of the public transport in the city. What it is very high is the rating for cycling. Cycling, it's growing really fast, and the people is very happy with it. But when we combine walking, bicycling, and public transportation, the overall rating is 32%. It is really low, and we need to move this upwards. Then the local plan has things that will help moving it upwards, but it doesn't have a target. So it's something we will continue putting some pressure on, so it improves. The really ambitious metric regarding road safety is a reduction of 20% in the next 4 years, which is consistent with the international recommendation recently in Stockholm by ministers of transport all over the world. So it is doable, but it is something that the city will continue to do a lot in terms of speed management and traffic calming and enforcement particularly. And the other one that I'm very interested in, and I really appreciate the comment by Esther that the inclusion in transport is so important, is that currently the system is not very inclusive. Travel time for low-income people is much higher than for high-income people, and travel cost is also higher for low-income people in a proportion of their income. The city has set a target of reducing the potential expenditure in public transport from 26% to 15%. And I do think that this is one of the most important policies in the current plan, is reducing the expenditure in that way, improving the opportunity to access jobs and opportunities. During the crisis, there are things that you have already mentioned that Bogota is doing: more public space for pedestrians and bike lanes. It is going to start a public bike sharing system, is doing operational improvements in the fleet, and which were delayed. This is important, and hopefully quality improvements, but it has the big challenge of financing these public transport operations during the crisis and beyond. And particularly the main challenge the city and all the cities in Colombia are facing is how to keep public transport moving people, even with low occupancy, but keep public transport and not canceling public transport. There are investments in metro, regional rail, and BRT already contracted, but these systems will start delivering service in 5 to 8 years. And there are ideas on freight and logistics, and also in private involvement. I just would like to finish the presentation with some pictures of what is going on in Bogota at this moment, and then we will continue to the Q&A. This is the network of temporary bike lanes that the city has put forward. It's 80 kilometers that are on top of 550 kilometers that were already happening. And the type of intervention, very similarly to Barcelona or London, are using cones, just reducing space for cars and increasing the space for people, and using police and volunteers in order to organize this. And we have now these 80 kilometers additional that are in key corridors of the city, like Carrera Séptima, which is in this picture. And these corridors need to be managed, and that's kind of the challenge at this moment, because they need to keep maintaining the location of the cones and activity. But this has increased the use of bicycles from around 800,000 bicycle trips a day to more than 1 million. And there are some metrics from Secretary of Mobility showing that increase. So in a way, it is working. It is working to help people move around. But we have, as a developing country with low income in general, we are facing a lot of problems in public space, and especially with the street vendors and activity, which is happening on the street, even though the space has been created, and things that are creating some opportunities for infection. And this is probably the most difficult thing that we are facing at this moment, is increasing the activities, and we are still growing the number of infections and deaths in terms of COVID. What I envision and what I would like to see is if we take this opportunity to aim at cities with a vision of zero fatalities, zero emissions, and zero exclusions, with better access, but with this vision. There are a lot of questions that we can talk about, and I will leave the presentation here so we can move to the Q&A.